since you came into this industry, and post that, what are the certain changes that you have seen so far?
The biggest shift, I guess, is what I mentioned, the shift towards more natural outcomes.
Right.
There is more acceptance towards aesthetic surgery. There is a natural curiosity which has always been there, but it is now becoming more and more approachable to more strata of society. I guess the biggest thing would be the shift towards natural outcomes and not really, refinement rather than overdone looks.
There are certain stigmas when a person actually goes ahead and thinks about getting a plastic surgery in India. Hi, on today's episode of Healing Beyond Borders, we have somebody very special. So we have a surgeon on our panel, and he's usually behind most of our international patients and giving them beautiful aesthetic looks. Today on our set we have Dr. Vashisht Dikshit, and he's a plastic and aesthetic surgeon. And he has also practiced on not only domestic grounds but also on the international grounds as well. And we would also like to know more about how and what is your take about the general aesthetics and cosmetic surgery with us. So it's great to have you.
Thank you for having me.
So can we start with a brief introduction of yours?
Sure. I'm Vashisht Dikshit. I am a plastic and aesthetic surgeon. And I guess my journey in this field has been very, very intentional. And I've always been drawn to fields that combine art and precision. And plastic surgery sits right at the intersection of all of this, right? So it was a fairly easy decision for me to make.
That's actually nice. Actually, I was going to ask you, like, what inspired you into this field?
So it began with actually more of the reconstructive part of it. But as I was doing my training, the precision and the fine work did appeal to me. But what appealed most was the transformative aspect of aesthetic surgery. I mean, to be able to combine, use science and use your skill and your techniques in order to restore not just form, but we are also restoring confidence. And, that sort of impact, I don't think any other field has as much of satisfaction for me personally. So again, that is what drove me more towards the aesthetic side of things.
That's lovely and actually inspiring. And as we know that you have also trained on the international grounds and not just the domestic ones. So what are certain changes that you have already seen, like while you were practicing, on the international side and domestically?
I guess if I had to shorten it, it would be perspective.
Right.
So my training in India definitely gave me a lot of volume. It gave me a lot of diversity, and it helped me establish very, very strong fundamentals. And when I did train abroad, it also, opened my mind to how people work elsewhere. It taught me more about the evolving nature of aesthetics. Primarily the focus shifting more towards natural outcomes rather than, overdone looks.
Right.
And so I have combined both of them into my practice here. So best of both worlds.
Right, absolutely. And so since you've been practicing, I think for the last 12 years, I guess, right. So in that decade, what are the certain changes since you came into this industry, and post that, what are the certain changes that you have seen so far?
The biggest shift, I guess, is what I mentioned, the shift towards more natural outcomes.
Right.
And also there is more acceptance towards aesthetic surgery. There is a natural curiosity which has always been there.
Right.
But it is now becoming more and more approachable to more strata of society. And I guess the biggest thing would be the shift towards natural outcomes and not really, refinement rather than overdone looks.
Right. I mean, that's absolutely there. And so, like, there are certain stigmas when a person actually goes ahead and thinks about getting a plastic surgery in India. So what do you think? How can you address those?
It's challenging, definitely. I mean, it is changing.
Right.
As I did mention, more and more people are beginning to be more accepting. But there is always a little bit of a hesitation, right? And which is why conversations like this are that much more important, to tell people that it is absolutely valid and justified to want to look okay, to want to look better, or, if there is something that is holding you back, then, and if you do have the means to go beyond that or address it, why not?
Absolutely makes sense. And again, coming back to the natural looking aspect of the, surgery and the aesthetic surgery. So how do you think you would want to address that, patients now actually prefer the, natural looking part rather than the overdone part?
Yeah.
So what do you think is your take on that?
I guess that has come because of awareness.
All right.
And also because of the rise of social media
Right.
and the internet, where people, they tend to, there is a little bit of education that is available, there is a lot of knowledge that is available, right? So they have seen the sort of, I wouldn't want to call them botched, but in the sense that unnatural results, right?
Of course.
So people do see it, and it is definitely something that does turn people away. And with increased awareness, I guess that is the primary thing that is driving this shift, towards refinement and wanting to look like yourself on your best day, rather than looking like someone else. That's not what you want. And the one line I use, I think that resonates the most with patients is, my work should make you look the way you feel, rather than
Right.
looking like someone else.
That absolutely makes sense. So, like, as you just spoke, like, social media has also caused a lot of awareness. But at the same time, I think, a lot of overdone aspects also come into the picture, like,
Absolutely.
overdoing the Botox, the fillers. I mean, of course, there are the non-surgical aspects
Yeah.
to the things. But again, like, how would you want to address those?
That's why my consults last so long. It just comes down to education.
Right.
I take my time to educate patients,
Right.
because filters are not anatomical, right? They're not
Absolutely.
anatomically accurate. And what a filter will do is not necessarily going to translate well into what you actually are going to look like. So it's primarily education, talking to people, telling them what is possible, what is not, and what is actually going to fit their face or their body or their anatomy. So it comes down to just taking my time and educating them, and getting them to understand what is possible and what is still left in the realms of social media.
Of course. I mean, of course, it's very, very unethical to have such unexpectedly high standards out of some surgical
Yeah.
outcomes. So, yeah. And so, when you get a personalized consultation done with a patient, so what are certain things that you would like to take care of during that consultation?
I would like to listen. That's number one.
Right.
Right. You need to take your time to listen to what the patient is talking about, over and above what I see myself. We tend to do that even if we are not plastic surgeons, even if we are not trained in this. The moment someone comes in or you meet someone for the first time, the first thing you notice is the face, the eyes, the nose, the lips, which are the most prominent parts of their face. So that took a little bit of training to stop myself from doing that. And beginning with just listening, understanding what a patient's goals are, understanding how their lifestyle is, and this really helps me tailor a plan. Right, because I don't believe in having one specific template for one procedure. Like, if someone comes in, tells me that I want a rhinoplasty, I want a nose job, it's not going to be a situation wherein I'm going to say that this is what I'm going to do, take it or leave it. I need to understand what exactly the patient wants out of the surgery, understand the goals of what goals they have, understand what lifestyle they lead, because that is going to tell me how much of my post-op protocol can they follow.
Right.
So it really helps me individualize. So listening is the biggest part of it. Obviously, having a thorough knowledge of anatomy and
Right.
understanding what is possible and what is not possible. And again, there is a bit of art involved as well, because then you can sort of
Right.
understand, what exactly is going to look good or what exactly is going to look harmonious is the right
Of
term
course.
for it.
So do you think like in all of this a patient's occupation or what work they do actually comes into the picture while framing a treatment plan for them?
Yes and no. It doesn't tell, it tells me how much they are going to be able to follow post-op protocols, because some procedures obviously do require more time. For example, someone would recover from a blepharoplasty and fat grafting much quicker than someone would from a facelift.
Right.
Right. And in terms of the work that they do, I need to understand how soon they need to return to work, and basically what it is that they do. For example, if someone is in a stream that does require a lot of physical work, then I need to be able to warn them from advance that you need to be able to take a break for at least about 4 weeks or so. If someone is working from a desk, then obviously they're going to be able to return to work a lot quicker. So if I am able to tell this in advance, it does help the patient plan out their time much better. And if I can get them, if something is planned, if something is set in stone before, it takes away a lot of the anxiety that comes. I mean, there is enough anxiety and fear in the post-op period already, right? Because people have swellings, and they may have some bruising, which can tend to scare them. And I don't think they need the added stress of, oh my God, when am I going to be able to get back to work? If something is planned in advance, then it makes the post-op recovery period much more smoother.
Yes, absolutely. I think, it's just going to add on to their anxiety if we just,
Absolutely,
like bombard them initially.
Yeah, and I like this to be a very comfortable experience.
Of course. And have you ever refused a procedure to a patient?
Yes, absolutely, yes. Uh, if something goes against, if something isn't in the best interests of a patient, whether it is medically, aesthetically, or ethically, I would say no. I mean, I would not compromise on ethics, number one. If something is unsafe, again, I would say no.
Right.
If someone wants too many things done at the same time, again, no.
Right.
Primarily because you're coming for an elective procedure, you're coming for an aesthetic procedure. I don't want you to end up in the ICU, right?
Right.
That doesn't make sense. I would much rather do one procedure, space it, allow enough recovery, and then do the second one, rather than trying to cram everything in the same time. And obviously, there are patients who have very unrealistic outcomes, unrealistic expectations, or they are asking for procedures for the wrong reasons.
Of course.
That would be, this is actually part of our training. I mean, this is actually part of our curriculum, is like when to say no. And but obviously this does come from experience, from seeing multiple, the more you see, the more you know. And you learn when to say no. If someone is asking you for a procedure, maybe to get someone back or something like that. And that becomes a little extreme. So you have to take a step back and say, I need you to think about this. And yeah, so I guess I do say no very, very often.
And I think it goes for the cases with body dysmorphia as well,
Absolutely.
who are absolutely really not
100%.
happy. I mean, no matter what you do or what you end up with, they might not be happy.
They're not going to be happy. Right. And it doesn't make sense to, put yourself through a procedure and still be unhappy.
Right. So, of course, it comes with a whole lot of consultation, I believe.
Yes.
And how would you ensure safety and ethical practice in general?
Qualifications, proper training, operating in centers which have enough backup, proper protocols that are set in place, because safety is a non-negotiable for me.
Right.
Again, coming back to the fact that I'm talking about, this is an elective procedure. This is not something that we're trying to do in an emergency.
Right.
This is planned. And so it is prudent to ensure that your safety protocols are in place, you have your lifeboats in place prior to going ahead with the procedure. So for anyone who's also looking for, for any sort of surgery, ensure your surgeon is accredited, ensure that they're operating in proper centers, ensure that all the adequate backups are in place. Your pre-ops should be very, very thorough. And obviously, if you have all your boxes ticked, your outcomes are going to be that much better.
Of course. And since we're talking about safety, might we just add on to that, how many procedures is it safe for a person to get at a time? Is it 2? Is it 1?
It depends. It depends on the surgeon. It depends on the patient as well. A younger patient who is in better health is obviously going to be able to withstand more in a given period of time compared to someone who is older, maybe say has comorbid conditions like diabetes or high blood pressure. So in these cases, so again, it is tailoring your procedures to the patient, right? There's no one size fits all. But if I had to, dumb it down a little, or simplify it rather, I would say I would cap out. I wouldn't want surgery to go beyond, say, about 5 or 6 hours.
Yes.
That's an easy way to go about,
Right.
understand things. The second thing is, if there is, if it's liposuction, I would have a safe limit. Typically around 10% of their body weight is how much I would be willingly wanting to remove at one go, because you have to think about how your surgery, how your procedures are going to affect the physiology of the body. And again, I don't want them landing up in the ICU. So I'm much more comfortable spacing out my procedures, giving enough time for recovery in the middle. And that it may seem longer if you consider, if you're looking at short term, but if you do have a complication, then your recovery is going to be much longer compared to just spacing out the two surgeries.
Right. And on that note, do you happen to have any memory of a past patient whom you would want to share about? Of course, without revealing the identity of
So,
such.
without going into specifics, I did have this one patient who had, she really wanted to get into the content creation space.
Oh, okay.
And she was very conscious about her nose.
Okay.
And so this is just one of it. And after the surgery, to see the videos go up, the confidence come back, it is very heartening. And there are so many others who avoid social situations, like maybe a young guy with gynecomastia.
Right.
And who loves swimming but doesn't go swimming because he was always teased.
Of course.
And then post surgery, to see him get back to what he loves doing, it's heartwarming. That's the impact part of the aesthetic
I think
surgery
you
that
must
people
be
don't really talk about.
right. I think that just gives a different sense of joy. Like, oh my
Yes.
God, I have created this, and
Yeah.
like they're enjoying what I have done to them.
Yes, absolutely.
So, what are some emotional changes that the patients experience after getting those procedures? I think it fits well with what we just discussed.
It's confidence. I think the number one is confidence, to be able to feel like themselves again.
Right.
And that really creates a shift in personality. And it allows them to be themselves with much more ease. And over time, you see there's a shift in the way they carry themselves as well, and it obviously would open a lot of doors for you, like be it career wise or socially, whatever it is. If something is sort of holding you back, and then that confidence it gives you post your surgery or your procedure or whatever, that's the biggest change I do see.
And is cosmetic surgery, do you think it's more about the looks or the confidence here?
A bit of both,
Okay.
obviously. I mean, the physical change does come first,
Right.
and the confidence follows soon after. So I guess the most impactful change is in confidence rather than the looks part of it. So it's the looks is just the means to the end.
Right. But I think it's the confidence that we are
Yes.
chasing. So, what do you think? What is your take about the fact that India is now becoming a, aesthetic hub for people who want, who are traveling internationally to get the surgeries done with, of course, the Indian surgeons, because we know that they are the best in class. So, what's your take on that?
It doesn't surprise me. Honestly, it doesn't surprise me, because we have surgeons here who are not only at the top of their fields, but they are internationally renowned as well.
Right.
And when you combine that with, excellent setups we have here and amazing value, I think that is the one that drives it home, the value proposition, because you're getting the same, if not better surgeons, you're getting the same, if not better procedures at really good centers, very well equipped centers,
Right.
for a fraction of the cost.
Right.
It's a no brainer.
Absolutely. And I mean, I think I've seen patients in the past who have come up with the statement saying that, of course, if it's an Indian surgeon, we would want to get it with him.
Yeah.
Why not? And so, what are some of the concerns that you would want to address, given the fact that we are dealing with international patients?
I think there is a lack of awareness about India.
Right.
But if you go deeper into it, you will see that it comes from, doubts regarding um, whether doubts regarding surgery itself, doubts regarding safety, doubts regarding the post-op protocols, how they're going to be able to follow it. So I guess it wouldn't be India specific. I guess if you looked at it deeper, it would be common across pretty much anywhere in the world, right? So it really, so awareness really helps. Um, Telling people, educating people about what we have available over here, what you're going to get out of it, having clear protocols, having proper post-op advice that is given to the patients, and communication,
Right.
that really goes a long way in allaying these fears that patients have.
And how would you ensure? Because of course, in case of domestic patients, we can take regular follow-ups from them. You can call them up to the clinic, see them physically. How would you ensure, such kind of follow-up with the international patients?
So a lot of it is established before surgery itself.
Right.
So there are thorough consultations that occur before your procedure. There is a video consult that happens before the procedure. During the procedure itself, you are taught what is going to happen, what are the changes that can be expected, what are the red flags that you have to be aware about. I do like to tell people to stay in the country for the first week at least, because
Right.
this is the most critical period of time. And if something has to go wrong, it usually does within the first week or two. uh, so that part of the follow-up is very, very easy for me to do. Secondly, having proper set protocols that are shared with the patient, which are, well simplified and, organized into what's going to happen on day one, what's going to happen in the first week, what do you need to do in the second week, third week, all the way up till around 6 weeks. So this plan and this protocol is shared with the patient. I do continue to communicate with them through either text or calls or video consults. And the internet has made the world a much smaller place.
Of course.
Right. And if required, I can also coordinate with local doctors.
Right.
That is also possible.
Other than that, do you think that international patients, how much time do you think? It might be a little anxious on their part, but after how much time of the surgery do they see the approximate results of their procedures?
It depends on the procedure, definitely. But a good rule of thumb is to give it at least 3 months.
Okay.
3 months will give you maybe around 80% of an idea of what your final result is going to be like. Typically, for most surgeries, say like rhinoplasty or facelifts or liposuction, especially tummy tucks, we are looking at 6 to 12 months. This is how long it takes for you to get a final look at what it's going to really look like. And this has nothing to do with the procedure. This has everything to do with how your body heals. And this is how long it takes your own body, to sort of, for everything to fit into place. So the internal healing part of things takes this long. But externally, things look much better, say within a couple of weeks or about a month or so.
So you would say that, there's a difference between healing of a Caucasian skin and an Indian skin in that manner?
Not exactly. I mean, the time it takes to heal doesn't really differ.
Right.
Caucasian skin, they scar much better.
Okay.
Compared to people who have darker skin tones. However, the flip side is that their skin is much thinner. They are more prone to wrinkling compared to people who are from the tropics.
Right. Okay. That was one thing I really wanted to ask. Okay, so do you think that the non-surgical procedures will have a rise in the near future?
They already are.
But I think there's a lot of botched cases of those, overdoing the fillers and the Botox.
So, yeah, I get that. I mean, what people tend to forget, or they tend to overlook the fact that it's not one or the other, right? The maximum impact you're going to get is when you combine both. So non-surgical and surgical complement each other. However, they are not a replacement for each other. And if you are going to try with a non-surgical technique to address a structural problem, you're not really going to get a good result. Which is why you see people with overfilled faces.
Right.
Because fillers can only take you up to a certain point, after which, beyond which, you are going to think fillers really aren't going to cut it.
Right.
But surgery is a little scary for people, and which is why people tend to gravitate more towards non-surgical work. But if your underlying problem is structural, if you have obvious descent of your face, if you have jowls, if you have thin skin, if you have deep smile lines and nasolabial folds and tear troughs, fillers aren't really going to cut it. The only way out is surgery.
Right.
It's a facelift, and in the long term, if you look at it, I mean, if you combine facelift with non-surgical facial rejuvenation, say with Botox or with laser resurfacing, you're going to get much better results.
Okay.
So the idea is to have non-surgical and surgical work complement each other rather than replace each other.
Okay, so I think, does that mean that, in order to maintain the results of a surgical procedure, you can get the non-surgical ones as well in the
Absolutely.
meantime?
So non-surgical really helps with maintenance. So non-surgical, I believe, I would like to include what you do at home in terms of skincare as well. That really goes a long way in helping you maintain your results.
Right.
So say, as I did mention, I gave you one example of, a facelift cannot change the texture of skin.
Right.
That is where non-surgical work like your laser resurfacing comes into the picture. If you get, say, a tummy tuck, you may have some loose skin, so a non-surgical body contouring, like maybe a radio frequency skin tightening, can help.
Okay.
So, and again, with maintenance, obviously it does help, goes a long way. So facelift will sort of turn back the clock, and then non-surgical helps slow it down.
That's good to know. So what procedures do you think are most in demand these days?
Most in demand, I would say facial aesthetic procedures like rhinoplasty, facelifts, a lot of breast surgery, and of course liposuction. Liposuction is something that everyone really wants. Everyone really struggles with a little stubborn fat here and there.
It's obviously the thing in most of the cases.
Yeah. So I guess these are the most sought after procedures that I've seen.
And you have specialization in all of those factors, or do you specialize in a one particular,
So my
aspect?
primary focus, I would say, over time has developed. I am more interested in facial aesthetic surgery, so that includes rhinoplasties, blepharoplasties, and facelifts. It's something that I really love doing. I also do a lot of breast work and body contouring as well. In addition to that, non-surgical options as well, so Botox, fillers, lasers. Uh, Primarily, the idea is to give a holistic result.
Right.
So that is going to give me the most bang for buck, and that is going to give the patient the most bang for buck. And happy patient, happy me.
Of course. What advice would you give to the patients who are getting the procedures? Let's say surgical, non-surgical, either ways. What advice would you give to them?
Do your homework. That's number one. I happened to mention it before, is ensure that your surgeon is accredited. There
Absolutely.
are accreditation bodies that are available that you can look up. So, for example, in India, you have an association called IAAPS, which is the Indian Association of Aesthetic Plastic Surgeons.
Okay.
They have a very thorough vetting process. So if your surgeon is a member of IAPS, you can be assured that that person is a qualified plastic surgeon who is trained in aesthetic procedures. Going internationally, you have an international body called the International Society for Aesthetic Plastic Surgeons, or ISAPS.
Okay.
Again, so these societies and associations have websites, and you can actually search to check if the doctor that you're speaking to is part of these associations.
That's actually fairly new for the audience, I believe.
Yeah, that's an easy way to find out.
Absolutely. I mean, I did not know about it. I was like, okay, this is something new. I need to catch on to that now. I think we'll rewind the tape again. And what are some mistakes that, a patient should avoid when choosing a surgeon?
Looking at price first.
Right.
I think that's a mistake everyone tends to make, and it's not just international patients; it's domestic patients as well. If your deal sounds too good to be true, then it probably is, right? So safety, uh, equipment, training, everything comes at a price, and you cannot be choosing a surgeon purely based on the price. And I would like to extend beyond that a little on the number of followers that they have on social media. Okay, that is another thing.
That's another criteria that they are
Yeah,
judging on.
that is fairly new, right? And so yeah, so you need to dig deeper,
Right.
dig a little deeper. Again, check with training, check where they are operating, have a word with them, ask them questions. If your surgeon does not answer your questions, then just walk away.
Of
Because there
course.
is no such thing as a stupid question.
Absolutely. And
Everything is valid.
I mean, nobody wants to be a guinea pig, obviously.
100%.
What would be the most enjoyable procedure for you to perform?
I would say rhinoplasty.
Really?
I really enjoy rhinoplasties because they are intensely technical.
Oh
There
my.
is no one single nose that people have. Everything is different,
Right.
and the impact that it has, right? It really changes the way someone looks. It really brings everything into harmony because the nose is such a focal point. It's one of the first things you notice when you're
Right.
speaking to someone. So eyes, nose, lips. That's the first few things that you notice, and to be able to change that even subtly, it really can bring a real big change. And so yeah, I enjoy rhinoplasties. I really enjoy facelifts as well. And so yeah, it's I don't know if I am beating myself up with going in for more harder and more technical
I
procedures,
think
but
when
this
you
is something that really challenges
No, but
me.
I think really when you said rhinoplasty, I was right there. Okay, this is the toughest field out of them all.
Yeah, I really enjoy it. It's really fun.
No, but I've heard about this that rhinoplasties are fairly harder procedures to perform rather than any other cosmetic procedures
No,
out there.
everything can be hard depending on how hard you make it for yourself. But yeah, it is a more technical procedure.
Right.
Even facelifts, they are more technical. So there is a lot more that you need to look out for. And even a millimeter here and there can really change your results.
Right.
And you can get away with a millimeter. You shouldn't, but you can get away with a millimeter or so when you're doing body contouring, but not when it comes to um, the eyelids or the nose or the face.
Of course. I mean, because that's the first thing that a person notices
Yes.
when you walk by. Of course.
Yeah. And you also have function to think of, right? You cannot have a nice nose that doesn't work.
Right. So, I think we've discussed this before. Surgical or non-surgical aspect. What do you think would be more impactful?
Both. Both. You need to select the right candidate. So patient selection is very important for this, right? You need to be able to tell depending on the patient's goals and really assess the patient, assess what exactly their concerns are and what would be required to manage those concerns, and then decide. So in the right candidate, a non-surgical approach can have beautiful results.
Okay.
uh, in the same candidate, maybe surgery wouldn't be the best option. Whereas if you try to fit in non-surgical work on a patient who does require surgery, you're not going to get a good result. So patient selection is critical.
Fairly noted. And what do you think is the biggest myth about plastic surgery?
There are so many. There are so many. Off the top of my head, I guess one of the biggest myths would be that it's unsafe.
Right.
I think that's one thing that stops people from going in and getting surgeries. With the advancements that we have seen in anesthesia, our techniques themselves are much more refined. We understand anatomy better, we understand physiology better, we understand the impact of what we're doing much better because we do have long-term studies as well now. So it is incredibly safe, provided you check all the boxes, provided you optimize the patient before surgery, provided you have good backups. It is extremely safe. So that I believe is the biggest myth. Um, Other myths would be, say, liposuction is a weight loss procedure. It's not. So liposuction, you're not talking in terms of kilograms, you're talking in terms of inches.
Right.
Right, and it's primarily for stubborn fat deposits rather than entire weight loss. So I think, yeah, these two would be the biggest myths that I hear. One is that it's unsafe, and number two, that liposuction is for weight loss.
Absolutely. And what is one word that you would define your patient-centric approach as?
Bespoke.
Really? I think we have it there.
Absolutely. So yeah, it's about tailoring the procedure to the individual to ensure that they get the best out of their result.
That's lovely. And I think we would like to end the podcast on that note.
Thank you so much for having me. It's been lovely.
It's been really lovely interviewing
Yes.
you, actually. So that was Dr. Vashisht Dikshit for you guys, and I hope you have gotten to know him more, not just as a surgeon, but as a person as well. And we'll be looking forward to having you on the next episode. Bye.